The topic is finance in dental care. So what is this finance in dental care? Basically the ways a patient when he gets his treatment done. So what are the mechanisms that he can pay the dentist? So that comes in the finance in the dental care. So the most commonly used mechanism of payment was private fee for service. So basically you're just paying whatever the treatment you're getting done. So you're just paying it at that time only. So it is not possible for every person to pay that fees if the treatment cost is too high. So to ease the cost of the treatment, there are these various mechanisms which were introduced. So various mechanisms of payment are, first is this private fee for service, post payment plans, then there is this private third party prepayment plans. In this you'll find all these things. The next is salary, then the public programs. In public programs you have Medicare, Medicaid and National Health Insurance. So basically I'm going to explain all this now. Starting off with the first, that is the private fee for service. Nothing but you're paying, so whatever the treatment you're getting done, you're paying at that time only. So it is the two-party arrangement. So it is the most traditional form of the reimbursement in the dental services. So basically this is the most commonly used one, where you are just paying the fees, whatever the cost is, at that time only. Now it has its advantages and disadvantages. So advantages are, it is acceptable. So basically first advantage is, it is culturally acceptable. The next one is, it is flexible. So this system is basically flexible. So basically it's like the fees, it can be changed according with the market conditions. Another advantage of it is, there is price discrimination which you can do in this private fee for service. So now what is this price discrimination? So everyone knows who was this Robin Hood. So this is nothing but a Robin Hood approach. In private fee for service you can apply this Robin Hood approach. So he was a person, what he used to do was, he used to steal money from rich and he used to give it to the poor. So basically it was like he was doing a bad thing but for a good cause. He was stealing money, that was a bad thing, but for poor, so that was a good cause. So basically you can apply this in dentistry too. So it's basically like, if charge more from the rich, and basically what he can do is, he can then reduce the charges for the poor people. So this is price discrimination. It is applicable in private fee for service. Next advantage is, it is simple, because in this the dentist, he do not have to keep a written record of everything. Disadvantages of it. So disadvantages is, now there is this flexibility, price discrimination, but even then some people, they cannot afford this dental services on the basis of private fee for service, and this becomes the disadvantage of private fee for service. Now the next one is this post payment plan. So what is this post payment plan? So in this what happens is, the patient, he borrows money from a bank. So basically he is borrowing money from any bank or any finance company. After that what happens is, there is the application which is approved by that bank or the company, and then the patient, he pays the dentist whatever the cost is, and after this the patient, they repay the cost, whatever the cost was, to the bank in a budgeted amount. So basically what does in this post payment is, patient, he borrows money from the bank, then there is this approval of the application, the patient, he pays all the money, whatever the cost is, to the dentist, and after that the patient, he then pays whatever the money he took from the bank to the bank in the budgeted amount. So this is nothing but post payment plan. Now what are the advantages and disadvantages? So advantages can be, mostly a middle class group people, they do this post payment plans. The next advantage is usually done to finance prosthetic and other costly treatments. So what you are doing is, you're getting your treatment done, and after that you're borrowing the money and you're then giving the money to the dentist. What are the disadvantages? Now the disadvantages are, so the problems can be, there will be defaulted loans, and next can be low income patients, they cannot afford this post payment plan. So this is nothing but the post payment plan. Third one is private third party prepayment plans. Now what is this private third party prepayment plans? So basically it is defined as the payment for the services by some agency rather than directly by the beneficiary. So what you were doing in post payment plans were the patient, he used to take money from the bank and then he is giving the money to the dentist, and after that he's repaying. So the patient, he then repays the bank. So basically it's like the patient, he takes money and give it to the dentist. So in third party payment plan is the agency, they are paying the dentist. So basically over here the agency, they pays the dentist and not the patient. So this is nothing but a private third party prepayment plan. So basically the dentist and the patients, they are the first and the second party. So the dentist and the patient, they are the first and second parties, and this agency, it becomes the third party. So this agency, whoever gives the money to the dentist, they are known as carrier or insurer or underwriter. So all these names are given to this agency who has this prepayment plan. What are the insurance principle and dental care? So to be insurable, a risk must be, it should be definable, then it should be of sufficient magnitude. Next is it should be infrequent. It should be of unwanted, it should be infrequent. It should be of unwanted nature. And next is it should be beyond the control of the individual. All the health insurance, they violate some of these principles. Since illnesses, it is not predictable for the individual and the healthcare is usually a wanted service. If you're taking a dental insurance, how it can be more feasible? First is the patient shares the cost. So over here the patient, they are sharing the cost. Then it limits the range of the services. Then next is it offers services only to the groups. Then it includes the waiting period after the enrollment, and last is it uses pre-authorization. It is a process wherein the dentist is required to submit the treatment plan to the insurer for the review before the treatment begins. So this is nothing but the private third party prepayment plan, and there are different ways of payment which are offered by insurer. So first is deductible, next is co-insurance, and third is group insurance. So deductible is nothing but, so there is a stipulated amount that the patient must pay towards the cost of treatment before the benefits of the program, and it is known as front end payment. So basically the bank or the insurer, they have decided a particular amount that the patient, he should pay, and after that they'll get all the benefits. In co-insurance, what happens is, if you're getting a treatment done, so you are paying suppose 20% of the treatment cost and the insurer, they pay 80% of the cost. So this is nothing but co-insurance. But now again, co-insurance, it has many limitations, like the services provided, they are limited, because the insurer, they are paying 80% of it and you are paying 20% of the treatment cost. And then group insurance is nothing but if any treatment is to be done into in various big groups, in that case you have to do this group insurance. So what are the methods of reimbursement? So it can be usual fee, the fee that the dentist charges usually. Then there is customary fee. Customary fee is nothing but the fees of the dentist other than usual. So if, for example, in that area many other dentists are working, and the cost for that is considered in customary fees. And the last one is reasonable fee. So fee is reasonable if it meets these two criteria, that is this usual and the customary fees. So in prepayments plan, you'll have commercial insurance companies, as we have seen the classification earlier. So there were these commercial insurance companies. So these commercial insurance companies, they work on the principle of profits. So there are these profits, and it's like basically the insurance companies, like your medical insurance, it works in the same manner. These are the commercial companies which provides you the insurance for the dental services. The next one is the non-profit health service corporation. In that you will see a Delta dental plans. So this is a non-profit one. So there is this Delta dental plans. So in 1966, with the help of ADA, a National Association of Dental Service Plan, it was formed, and this later it changed its name into Delta Dental Plans in April 1969. So this is nothing but your Delta Dental Plans. So basically, how is the reimbursement of the dentist in this plans? So again, it follows this UCR concept, that is your usual, customary and the reasonable fees. And there are two ways in which a dentist he can use this dental plans. There is this participants and non-participants. So what are the differences between a participating dentist and a non-participating dentist in this Delta Dental Plan? So participating dentist, he should have a pre-filling of their usual and customary fees. Then there is acceptance of the payment for the services at 90 percentile. Then you should keep your records, because anytime a audit he can come and he can check your records. Next is a post-treatment inspection is randomly done on patients. These are the conditions for the participating dentist. But in non-participating dentists, there are nothing like this. There are no audits, they don't have to keep the records, or they don't have to show their usual and the customary fees. But now what is the disadvantages between these two? So there is this 90 percentile system. So now in this, for example, if there are 100 dentists working in an area, okay, and in that you will see the prices for oral prophylaxis, for example, is between 50 to 100 rupees. Now in this Delta Dental Plan, what they do in this 90 percentile, what they do is they arrange the numbers of the dentist according to the price. So for example, if the first dentist, so the minimum price is 50 rupees, then the next dentist 55, 60, 62, 65. So like this, they are arranging all the dentists from 1 to 100 according to their price ranges. So the minimum it comes at the first, and the maximum it comes at the, so 900 rupees was the maximum one in that area. So it comes at this 100 rate. And in 90 percentile, what happens is, if you are a participating dentist in this Delta Dental Plan, so there is this 90%, and if the 90th dentist, he takes 95 rupees for the oral prophylaxis. In 90 percentile, if you are a participating dentist, then all the dentists between 1st to the 90th dentist, they'll get the price. Example, now for the first dentist, the price was 50 rupees. So he'll get this 50 rupees for his treatment. And the 90th dentist, he'll get his 95 rupees for his treatment. But the disadvantage in this 90 percentile is, now from the number 91 till 100, the dentist, he'll get 95 rupees only. The one 90 percentile, so the dentist which was at this 90th number, so the price of it was 95. So all the dentists beyond 90 will get this same price only. So this is the maximum price that can be given to a dentist if the dentist is a participating dentist. But now if the dentist, he comes into a non-participating one, so in that he'll get whatever the 50 percentile. So in that case, they follow the 50 percentile criteria. So whatever the price is for the 50 dentists, so for 50 dentists the price was 75. So now after 50 dentists, whatever the price is, all the dentists will get this 75 only. Even though their price is 100, they'll get 75 only. So this is the disadvantage between participating and non-participating dentists, and this is nothing but a 90th percentile. So they draw a graph. So basically there's this graph. So for example, the price is over here, so it is increasing. So for first 10 dentists, they have the price of 50. So after that, they have the price of 60, then 70. So like this, the price, it goes on increasing, and they are arranged according to the increasing price. And in 90 percentile, participating dentist, he get 90% of it, and in non-participating 50% of it. Now whatever, it's like, if your cost, if the usual fee or this 90 percentile, whichever is less, so the dentist, he'll get that amount only. So this is nothing but 90 percentile. So the next non-profit health service corporation is this Blue Cross Blue Shield Association. So basically this was a federation of 38 separate health insurance organization and companies in United States. And the history of Blue Cross dates back to 1929. So it was formed in 1929, and these non-profit health service corporation, they have for years offered limited dental coverage as a part of medical policies. So this is nothing but again a non-profit corporation. This is the Blue Cross or Blue Shield Association. The next one is the prepaid group practice. Now what is this prepaid group practice? So basically in this there are various type of group practices which are done. For example, there is a general practice group. So there is a general practice group. The next one is single specialty group. Then there is multi-speciality group. So basically it has this advantages like it provides better way of organizing one's life. For example, vacations, continuing the educations, and there is less disruption in the practice if the dentist is ill. The next is the quality of the care is said to be improved because of the built-in peer review, and this is nothing but a prepaid group practice in which a group is practicing under. So basically what happens is, if a dental practitioner, a normal dental practitioner who has completed his BDS is having a clinic, and then a patient walks in and he wants a orthodontic treatment to be done. So this BDS dentist, he cannot do that orthodontic treatment, and in that case he's calling a orthodontist, and then the orthodontist does the treatment for this patient. So this is nothing but a prepaid group practice. So the dentist, so this BDS dentist, he's paying that orthodontist to get this treatment done for the patient. So this is nothing but a prepaid group practice. The next one is the health maintenance organization. So basically health maintenance organization, it is defined as it is a legal entity which provides a prescribed range of health services to each individual who has enrolled in the organization. So this is nothing but an organization who helps in like providing the services of the dental. Now the next one is the capitation plan. So basically in this capitation plan, what happens is the dentist, he gets an amount. So he gets a established or negotiated sum of a monthly or a yearly basis amount for each eligible patient, and the money it is paid regardless of whether the patients they utilize care or not. So basically it's like the dentist, they get a fixed amount monthly or yearly, irrespective if the patient he is getting the treatment done or not. That is nothing but the capitation plans. The next one is the salary. So dentists in some group practices, those who are in armed forces and those who are employed by the public agencies, they are salaried. So basically dentists, they get salary. Basically it's nothing but the dentist, they get salary, fixed salary. So advantage is it allows the dentist to be largely free of the business concerns. Now starting off with the public programs. So public program is usually not able to meet the dental demands of all the people. There are therefore a number of public programs which are aimed at meeting the needs of a specific group. So there are these three public financing, which are the Medicare, Medicaid and the National Health Insurance. So Medicare, now Medicare is, so it has two parts, hospital insurance and supplemental medical insurance. So both the part, it contains a highly complex series of services, and these services, they are provided only when the patient is above 65 years. So if the patient is above 65 years, so the treatment cost, it is covered by this Medicare. Then the Medicaid. So Medicaid is basically, it is like a joint federal state program. It covers at least this basic services. So basically this Medicaid, it covers inpatient hospital care, outpatient hospital care, if there are this X-ray services or laboratory services, if it requires a skilled nursing facility, then home health services for individual aged 21 years and above, family planning services, then physician services. So these are nothing but what are covered under this Medicaid. But now what are the limitations of Medicaid? So it is a very extremely complex program which was like put forth. So the application process to determine the eligibility for Medicaid is complicated and it is confusing to many people. And people like, so there are certain groups such as widows, who are under 65 years and the families without children. They are identified as, basically they're not eligible. So these two groups, they are not eligible for Medicaid. So this is the drawback of Medicaid. And the next is the national health insurance. So national health insurance, it was introduced by Bismarck in Germany in 1880. And this is nothing but it is primarily a financing mechanism by which the healthcare services, they are paid from a publicly organized fund. So basically national health insurance is nothing but financing the services by a publicly organized fund. So these are nothing but the public programs. And this is all about the finance in dental care, and the most commonly used finance in dental care is private fee for service. It is not that developed in India as of that dental insurance. Like people in India, they have medical insurances, but they don't have they don't have this dental insurances as it is like compulsory in USA. People over there, they have this dental insurances, but in India it is not yet that much developed that people are having dental insurances. Then most commonly one in India is this private fee for service. This was it about this finance in dental care.